Welcome back to this last video of the digestive system, where we are going to be talking about blood vessels related to the liver. So blood vessels bringing blood into the liver and draining the liver. So to understand that, we have to start with arterial blood from the abdominal aorta. And the first branch of the abdominal aorta, just below the level of the diaphragm, is the celiac trunk. And as you recall, it has 3 branches to the trunk. It has a branch that goes up and then over to the left to the lesser curvature of the stomach. It has a second branch that goes directly left over to the spleen. And then the third branch, the one we're most interested in, is called the common hepatic artery. And that can be seen right on the superior surface of the pancreas in the retroperitoneum. And remember that the common hepatic artery is quite short. If we look at this far left picture, you can see all 3 branches. The arrow is pointing to the very short common hepatic artery. We have here below the stomach, this is the splenic artery going over to the spleen right here. And then this number 7, I think this is the stomach cut in half, because it should be joining over to number 11 over here. This should all be one big structure, but that sits in front of the pancreas. You wouldn't be able to see the pancreas, and then you wouldn't have been able to see the splenic artery as well. And then the third branch is this one going up here, which is your left gastric artery. So the common hepatic artery, as you can see, is going to have multiple branches. And the one branch we are interested in is the hepatic artery. And how can you tell if you have the hepatic artery? Well, it's going to enter the liver right next to the hepatic portal vein. So you're going to see 2 structures entering together. In this model, the hepatic portal venous system is all in blue and not in purple. The same thing in this model, all the hepatic portal structures are in blue like normal veins, whereas in this model, the hepatic portal structures are in that lilac color. But doesn't matter, the hepatic artery is going to be next to the hepatic portal vein in every model, because this is how the liver gets its blood. Now, going back to the aorta again, the next blood vessel you would see coming off that's unpaired would be the superior mesenteric artery. And this can be seen in digestive system models right below the inferior surface of the head of the pancreas and just above the terminal retroperitoneal portion of the duodenum. We have the superior mesenteric artery there. So you can see that in all 3 of these digestive system models that have pancreas. So anytime you're looking at pancreas, look at the inferior border, and that's where your superior mesenteric blood vessels will be found. Now, recall that the superior mesenteric artery sends blood to all of the small intestines, both the right and the left side, but then it also sends blood to the right side of the large intestine. So specifically, we are looking at the cecum, the appendix, the ascending colon, and the right side of the transverse colon. So if you look at the large intestine model, when you see blood vessels going to the right side of the large intestine, these are all going to be branches of the superior mesenteric artery. And then the final blood vessel bringing arterial blood to the digestive tract proper is going to be the inferior mesenteric artery, and that's only going to be bringing blood to the left side of the large intestine. So any of these blood vessels here that you see going to the left side of the transverse colon or the descending colon or the sigmoid colon, any of these are branches of the inferior mesenteric artery. Okay. And so if the inferior mesenteric artery is supplying them with blood, then it would make sense that the inferior mesenteric vein would be draining them. Okay. So you will find inferior mesenteric vein adjacent to the inferior mesenteric arteries on your digestive system models. Now on your pancreas model, where I want you to realize that this is still going to be on the left side once all the branches drain together. However, it's going to be pretty close to the midline. So that is why on the pancreas model, you see the inferior mesenteric vein here, pretty close to the midline. Remember the celiac trunk, this is the abdominal aorta right there in the midline. So we still are on the left side of it. And then the inferior mesenteric vein is going to be draining into the splenic vein, which is normally posterior to the spleen. So if we look at this bottom left-hand corner, you can only see the splenic vein leaving the spleen, and then it kind of dives behind and you don't see it again. Whereas on this upper model, they've taken a little bit of artistic license and they've put the splenic vein all the way across the top of the pancreas so you can see it all the way. So the splenic vein will then be joining with blood from the superior mesenteric vein. So the superior mesenteric vein is draining blood, yes, from all of the small intestine. However, it's also draining blood from the right side of the colon. So any veins here on the right side. And so this is the most right vein draining from below. Where are you going to find it? Not on a large intestine model. Well, you're going to find it sitting right next to the superior mesenteric artery. In other words, below the pancreas and above the retroperitoneal part of the duodenum. Once the superior mesenteric vein has joined with the splenic vein, then it forms the structure known as the hepatic portal vein. And the hepatic portal vein is going to be sending blood into the liver, and it is about 4 times larger than the hepatic artery because 80% of the blood entering the liver comes from it. So those two blood vessels show up together again. Pointing out once more on these two models all the way on the left side, the hepatic portal vein is purple, whereas in this model here in the middle, and on some other of your models, the hepatic portal vein will be purple and not blue. So now we have all the blood into the liver that's going into the liver. The liver will do its thing, and then blood will exit the liver, not down here from the hilum, but from this more superior aspects through the hepatic veins. So anything that you see draining the liver is a hepatic vein. So it's super important that you write hepatic portal vein if you mean the hepatic portal vein, because otherwise you are talking about this structure, which is just the hepatic veins. And all the hepatic veins then drain into the inferior vena cava. This is the last blood vessel entering the inferior vena cava. Immediately after this, inferior vena cava goes through the diaphragm and dumps all the blood into the heart. And with that, we are completely done with the digestive system. And I will see you again soon for the next organ system. Thank you for all your hard work.